Welcome to vpod.ai and welcome to the Deep Dive. We're here to cut through all the noise, really get to the core insights, and help you feel genuinely well-informed. Today, we're taking a really important look at endometrial cancer. Our goal is to break down some pretty complex information into something clear, concise, and hopefully engaging for you. And just before we dive in, a quick word. This deep dive is sponsored by Stonefly. They're your trusted solution provider and advisor for all things enterprise storage, backup disaster recovery, hyper-converged setups like VMware, Hyper-V, Proxmox clusters, AI servers, the SA365 security appliance, and cloud solutions, both public and private. You can check out all their innovative work at stonefly.com.
Yeah, thanks for tuning in. It's a really important topic. Endometrial cancer is actually one of the most common cancers affecting women, but, public awareness often seems surprisingly low.
That's exactly it.
Yeah, awareness of symptoms, risk factors,
Yeah.
it's often lacking, and that can unfortunately mean later diagnoses sometimes. So our goal today is really to equip you with that essential knowledge, help you feel proactive and informed.
Okay, so let's start right at the beginning then. What exactly is endometrial cancer? Why is it so crucial we're dedicating this deep dive to it right now?
Right. So basically, endometrial cancer is a cancer that starts in the endometrium.
Okay.
Think of the endometrium as the inner lining of the uterus or the
Yeah.
womb. Now, you might hear people use the term uterine cancer more broadly,
Yeah, I've heard that.
but it's actually important to distinguish endometrial cancer from other types, like, say, cervical cancer, which affects a totally different part of the uterus, or uterine sarcoma, which is rarer and starts in the muscle wall.
Got it. So it's specific to that lining, and you said it's common.
Oh, absolutely. It's actually the most frequently diagnosed gynecologic cancer.
Mm-hmm.
And in developed countries, it's the most common cancer of the female reproductive tract overall.
Wow.
And what's really concerning, unlike trends we see with some other cancers, the number of new cases has actually been increasing in recent years.
Really? Increasing.
Yeah. For instance, in the UK, they saw something like a 40% rise between 1993 and 2013. And part of that seems linked to rising obesity rates and, populations getting older generally. These are pretty significant shifts we're seeing globally.
That is a stark increase, definitely highlights why this awareness piece is so critical. So who is typically affected? Is this rise happening across all age groups?
Well, the median age for diagnosis worldwide is around 63. And yeah, about 3/4 of cases, 75%, happen after menopause.
Okay, so mostly postmenopausal.
Mostly, but not exclusively. That's the key thing. It definitely can affect younger women, too. Around 5% of cases are in women under 40, and maybe 10–15% in women under 50. So it really means that women across a pretty wide age span need to be aware.
Okay, so given how common it is and this upward trend, what are the absolute key warning signs? How do people usually find out they might have this?
The number one, most common and truly crucial symptom is abnormal vaginal bleeding.
Abnormal bleeding.
Yes. And this isn't just, a minor thing. It's a really critical signal from your body. It should absolutely never be ignored.
So it's basically the body's main alarm bell for this condition.
Precisely. Actually, something like 90% of women diagnosed with endometrial cancer after menopause experienced abnormal vaginal bleeding.
90%, that's huge.
It is. And it's present in about 2/3 of all cases of adenocarcinoma, which is the most common type of endometrial cancer, the kind starting in the gland cells lining the uterus. It's what we often call a wonderful signal because it really does prompt investigation.
Right, it makes you go get checked out.
Exactly.
Yeah.
And often that investigation involves an endometrial biopsy, which for many women can be a pretty simple, quick procedure done right there in the doctor's office.
We actually have a powerful example of this, Kirsten Arendes, diagnosed at 51. She described having super, super heavy periods months after she thought menopause was done. She initially brushed it off.
Which is easy to do.
Right. But then it happened again, she sought help, and her doctor immediately flagged it as abnormal. Her story just perfectly highlights why you can't dismiss those signs.
It really does. That kind of postmenopausal bleeding is a major red flag. But, where it sometimes gets trickier is diagnosing it in women who haven't reached menopause yet.
Ah, okay. That's an interesting challenge. Why is it more complicated for premenopausal women?
Well, think about women who've maybe never had what you'd call regular periods, perhaps due to conditions like endometriosis or PCOS, polycystic ovary syndrome.
Okay, so their baseline is already irregular.
Exactly. If irregular bleeding or spotting or heavy periods have kind of always been their normal, it can be much harder to recognize when a change in that pattern is actually something new and potentially concerning.
That makes total sense. They don't have that clear before and after picture.
Right. Take Becky Black, diagnosed at 39. She'd had irregular cycles pretty much her whole life, and then started experiencing bleeding between periods. Or Trelisa Woods, she had heavy irregular periods because of endometriosis and PCOS. When her bleeding got even worse, she initially just thought, oh, it's getting older, She kind of explained away the increased bleeding, the bloating, the abdominal pain as just age or worse cramps.
And I understand sometimes, for younger women especially, it can almost be discovered by accident, like when they're seeking help for infertility.
That does happen, yeah. Callie Glaze, for instance, she was diagnosed at just 31. She'd been trying to get pregnant for years, and the cancer was found when she was seeing a specialist about ovarian cysts.
Wow.
Her story really shows how the underlying issues that can lead to infertility, things like not ovulating regularly, often linked to PCOS or obesity, are often the same issues that predispose women to endometrial cancer. It kind of connects the dots there.
So bleeding is the main thing. Are there other symptoms, maybe less common ones, that should still raise a flag?
Yes, definitely. Though less frequent, things like persistent pelvic pain, unexplained weight loss, or maybe an unusual vaginal discharge can also be signs.
Discharge, oh,
Yeah.
well.
There's the story of Moina Faruqi. She had this abnormal discharge for about 3 months before she was diagnosed, unfortunately at a late stage at age 65. So it's just a reminder that while bleeding is the big one, other persistent changes really do need medical attention too.
Okay, so these symptoms are obviously key, but it's also worth pointing out, right, that routine screening isn't generally recommended for everyone for average risk individuals.
That's correct.
And pap smears, which most women know about, they don't really detect this specific cancer, do they?
No, exactly. A pap smear is designed to check for changes in the cervix, not directly in the endometrium. That's precisely why being aware of these specific symptoms is so vital. They really are your personal early detection system.
Right. Okay, let's shift gears a bit then. Let's dive into what actually increases someone's susceptibility. What are the biggest risk factors? And just as importantly, is there anything that can actually offer some protection?
Okay, so when we talk risk factors for endometrial cancer,
Mm-hmm.
a major theme is high levels of estrogen exposure.
Estrogen, right.
And right at the very top of that list is obesity. It's estimated that around 40% of cases are directly linked to obesity.
40%, that's huge.
It really is. And this isn't just a statistic. It really highlights how much our lifestyle choices, particularly around weight, can be one of our most powerful, actionable defenses. The mechanism here is that excess fat tissue actually converts other hormones in the body into estrogen. So the endometrium ends up being constantly exposed to higher estrogen levels than it normally would be.
That's a really clear link between weight and this specific cancer.
It is. And other big hormonal risk factors include conditions like PCOS, which we mentioned, that often involves hormonal imbalances. Also something called unopposed estrogen replacement therapy.
Unopposed, what does that mean?
It means taking estrogen therapy without also taking progestin, which normally helps balance out estrogen's effect on the uterine lining. Without that balance, the endometrium gets constantly stimulated. Also, having a longer fertility span, like starting periods early or going through menopause late, just means more years of estrogen exposure overall, which also increases risk.
Okay, so hormones are clearly a massive piece of this puzzle. What about genetics? Do inherited conditions play a role too?
They do, yeah. Inherited genetic factors account for maybe 2 to 10% of cases.
Yeah.
The most well-known one here is Lynch syndrome.
Lynch syndrome, okay.
It's an inherited disorder that dramatically increases the risk for several cancers, including endometrial. Women with Lynch can have a lifetime risk as high as 70%, which is incredibly high. And what's really striking is that endometrial cancer often shows up years before other Lynch-related cancers, like colorectal cancer. There's also Cowden syndrome, another genetic condition which carries about a 5 to 10% lifetime risk.
I've also heard talk about a connection between certain breast cancer drugs and endometrial cancer. Could you clear that up for us? Because that sounds concerning.
Yeah, that's a really common question, and it's important to get it right.
Yeah.
So genes like BRCA1 and BRCA2, famous for breast and ovarian cancer risk, they don't directly cause endometrial cancer.
Ah, okay.
The link people sometimes hear about usually relates to the drug tamoxifen. Tamoxifen is often used to prevent breast cancer recurrence or lower risk in high-risk women. The issue is it can act like estrogen in the uterus. So yes, it is associated with an increased risk of endometrial cancer, especially in older women. Taking it for 5 years might even quadruple the risk.
Quadruple.
But, and this is the crucial part for listeners, for women who need tamoxifen for breast cancer, the benefits in fighting that cancer almost always massively outweigh this specific endometrial risk. It's a very calculated medical trade-off.
That's a really important distinction to make. Okay, what about other sort of general health things beyond hormones and genetics? Anything else that might influence risk?
Sure, things like having had ovarian cancer before or previous pelvic radiation therapy, certain conditions causing low immune function, even high blood pressure seems to have a link. And here's one that really surprised me when I learned about it.
Oh, yeah.
Even if you exercise regularly, just sitting for long periods every day is associated with higher mortality from endometrial cancer.
You're kidding, even with regular exercise.
Even with regular exercise, it really drives home how much our moment-to-moment lifestyle choices matter beyond just dedicated workout time.
That is definitely an eye-opener. Wow. Okay, so knowing all these risks, what can someone actually do? What are the proactive steps to potentially lower the risk?
Right, the proactive side. The most impactful things really do come back to lifestyle. Maintaining a healthy weight is huge. Engaging in regular physical activity is incredibly powerful. We're talking studies showing risk reductions of like 38% to 46%.
It's substantial.
It really is. And for women struggling with obesity, bariatric surgery has actually been shown to slash the risk by as much as 81%.
81%. That's incredible. So weight management is just central here.
Absolutely. And it's not just about reaching a certain weight. It's also about weight stability, gaining significant weight as an adult, and also that pattern of weight cycling, losing and regaining weight repeatedly. Those are also recognized as independent risk factors.
Yeah.
It really speaks to finding sustainable, healthy habits.
Okay, so lifestyle is key.
Mm.
Are there any medical interventions or maybe medications that can offer protection?
Yes, definitely. There are significant protective effects from certain things. Progestin, for example, which is the hormone found in combined oral contraceptive pills, the pill, and also in hormonal IUDs.
Right, like the Mirena.
Exactly. Those significantly reduce risk. Taking combined pills can cut risk by over half, maybe 56% after 4 years, and potentially up to 72% after 12 years. And what's really impressive is that protection seems to last for at least 15 years, even after you stop taking them.
15 years, wow.
Yeah. And even non-hormonal IUDs, the copper ones, seem to offer some reduced risk too, though the mechanism there is less clear. Maybe something about increased shedding of the lining or changing hormone receptors.
Okay. Any other sort of unexpected protective factors?
Well, there's one that's surprising but comes with massive health warnings. Smoking.
Smoking.
Actually does seem to have a protective effect, especially for that type I endometrial cancer. It might be due to how it affects estrogen metabolism. Maybe it's linked to lower weight or causing earlier menopause. And this is a huge, but the devastating negative health consequences of smoking overall, lung cancer, heart disease, everything else.
Yeah.
They vastly, vastly outweigh any tiny benefit here. It is absolutely not a recommended prevention strategy.
Okay. Good to clarify that very strongly.
Definitely. On a much more positive note, having children is protective. Having more than 5 kids, what they call grand multi-parity, offers protection. But even just having one child cuts risk by about 35%. And breastfeeding seems protective too. Doing it for more than 18 months is linked to about a 23% risk reduction. Again, likely related to the hormonal shifts during pregnancy and lactation.
Okay, so if someone does have symptoms and there's a concern, walk us through how doctors actually figure out what's going on. How do they diagnose it, classify it, and then decide on the best treatment?
Sure. So the first step in diagnosis is usually getting a tissue sample to look at under the microscope. This is typically done either with an endometrial biopsy, which is often done in the office, like we mentioned,
Right.
or sometimes through a procedure called a dilation and curettage, a DNC, which is usually done under anesthesia. Once cancer is confirmed from the tissue, the next step is figuring out how far it might have spread. That involves imaging tests, like a transvaginal ultrasound or maybe an MRI scan.
Okay, so tissue sample first, then imaging.
Exactly. And what's really crucial after the diagnosis is accurately staging the cancer. This tells us how advanced it is and really guides the treatment plan. We use the FIGO staging system. That's the International Federation of Gynecology and Obstetrics system.
FIGO staging.
Yeah, it's the standard worldwide. It classifies the cancer from stage and gown. I mean, it's just confined to the uterus itself, which generally has the best outlook all the way up to stage 4, where it's spread to distant parts of the body. Basically, the lower the stage number, the less spread, and the better the prognosis tends to be.
And are there different types of endometrial cancer as well?
Yes, broadly speaking, we divide them into two main types. Type I is the most common. It's typically lower grade, often driven by estrogen, and generally has a good prognosis. Then there's type 2. It's less common, tends to be higher grade, more aggressive, and unfortunately carries a poorer prognosis. We also know type 2 is disproportionately more common in Black women, which is an important health disparity.
Okay, so once you have the type and the stage, what does that mean for treatment? What are the main approaches?
Surgery is really the cornerstone of treatment for about 90% of cases.
Surgery first.
Yeah. Most often, this means a hysterectomy removing the uterus, along with removing both ovaries and fallopian tubes. Sometimes nearby lymph nodes are removed as well to check for spread. Now, historically, this was often done via a large incision, an open surgery called laparotomy.
Right, the traditional way.
Exactly. But thankfully, surgical techniques have advanced a lot. Now, minimally invasive approaches are often preferred, things like laparoscopy using small incisions in a camera or robotic-assisted surgery. These generally mean fewer complications, less pain, and much quicker recovery times for patients.
That's great progress. What about for younger women? Is preserving fertility ever possible?
Yes, for some younger women with very early-stage, low-grade cancers, there might be an option for fertility-sparing treatment. This usually involves using high-dose progestin therapy to try and treat the cancer without removing the uterus, potentially allowing them to have children later.
Okay. And beyond surgery, what other treatments might be used?
Other therapies often come into play, especially depending on the stage and type. Chemotherapy is frequently used for more advanced cancers, or if the cancer comes back after initial treatment. Radiation therapy, sometimes given internally using something called vaginal brachytherapy.
Brachytherapy.
Yeah, it's where they place a radiation source temporarily inside the vagina to target the area very precisely. That can help reduce the chance of the cancer returning locally. And then there's hormonal therapy, which can be effective for certain tumor types, particularly those that are sensitive to hormones like progesterone and estrogen.
And I remember you mentioning a newer targeted therapy earlier.
Right, dostarlimab. That's an example of targeted therapy, which is a really exciting area. Unlike chemo that affects all rapidly dividing cells, these drugs are designed like smart bombs. They target specific molecules or genetic markers found primarily on the cancer cells.
So much more precise.
Exactly. It allows for a more focused attack on the cancer itself, hopefully with fewer side effects on healthy tissues. It's approved for certain endometrial cancers that have specific biomarkers.
That really sounds like fantastic progress. So, okay, someone goes through treatment. What does the journey look like after that? What's the general outlook, the prognosis, and what's coming down the pike in research?
Well, the overall 5-year survival rate for endometrial adenocarcinoma is actually pretty encouraging. It's around 80%.
80%. That's good to hear.
Yeah. And for stage I cancers, caught really early, the prognosis is much better, like 88% survival for stage IA. Of course, the rates are lower for more advanced stages, but thankfully, most cases are diagnosed at earlier stages.
Okay, and what about the chance of it coming back, recurrence?
For those early-stage cancers, the recurrence rates are somewhere between 3% and 17%. Most recurrences, if they happen, tend to occur within the first 2 to 3 years after the initial treatment is finished.
And beyond the cancer itself, what about long-term health for survivors?
That's a really important point. For endometrial cancer survivors, unfortunately, other health problems like heart disease and complications related to obesity are actually common causes of death later on. It really highlights how crucial it is to adopt and maintain a healthy lifestyle after the cancer diagnosis. It's strongly linked to better long-term quality of life and overall health.
So beating the cancer is the first major hurdle, but the health journey really continues afterwards. And speaking of continuing, what exciting things are happening on the research front? What's on the horizon?
Oh, the research landscape is incredibly active right now. It's really offering a lot of hope. For example, researchers are looking into existing drugs like metformin, which is commonly used for diabetes,
Right.
to see if it might help slow down cancer cell growth,
Okay.
especially in women with obesity. There's also a huge focus on developing even more sophisticated targeted therapies like PRP inhibitors and mTOR inhibitors designed for cancers with very specific genetic mutations.
More personalized medicine.
Exactly. And even in diagnostics, there are exciting developments. One study looked at using infrared light on blood samples and showed amazing accuracy, like 87%, in detecting uterine cancer. Incredibly, in that small study, it even detected precancerous changes in all the cases they tested.
Wow, infrared light on blood, that could be game-changing for early detection.
Potentially, yeah. And surgically, techniques like sentinel lymph node biopsy are being refined. The goal there is to more accurately check lymph nodes for cancer spread, but with fewer side effects than removing large numbers of nodes.
These advancements sound truly inspiring. It really makes me think, and maybe for you, our listener, too. Considering everything we've covered today, the vital role of symptom awareness, the huge impact of lifestyle, the potential of these cutting edge treatments and detection methods, which single area do you personally believe holds the most promise for really reducing the burden of endometrial cancer in the coming years? Is it prevention, early detection, or these new therapies? Something to ponder. We have certainly covered a lot of ground today, from really understanding what endometrial cancer is and why it's on the rise, to recognizing those critical symptoms, untangling the complex web of risk factors, and knowing the proactive steps you can take. We've also looked at how it's diagnosed, the evolving treatment landscape, and the very hopeful research that's ongoing. Our aim, really, was to give you clear, usable insights, cutting through the noise so you feel genuinely informed on this vital topic. And just one final reminder from our sponsor, Stonefly. They're currently offering a 100 TB immutable and air-gapped SSO NAS solution for just 8,995 PLRs.
Ultimately, I think being deeply informed about your own body, recognizing those signals we talked about, that's just so incredibly important. That power of personal awareness, when you combine it with the amazing progress happening in medical science,
Yeah.
it really can make a huge difference in navigating complex health challenges like endometrial cancer.
Couldn't agree more. Thank you so much for joining us on this deep dive.